Thank you, Mr. Chairman. Mental health issues are certainly important to my colleagues who serve with me on the Health Subcommittee. 2 years into this COVID-19 pandemic with no definitive end in sight, so many Americans are clearly experiencing anxiety, fatigue, and depression. And social isolation has, of course, only exacerbated pre-pandemic mental health challenges. This burden has been particularly profound for our health and human service workers, as we have heard from our witnesses. These are the frontline people that are working to protect our communities with immense personal sacrifice. These workers have faced unfathomable trauma day after day, with patients experiencing emergencies and the uptick in violent crimes and vulnerable communities being further disconnected from the supports that they need. The stress, the genuine anger and despair witnessing such trauma can be compounded by poor working conditions. Many of these responders have lacked adequate personal protective equipment. Some employers have demanded that workers come to work sick, and many have failed to provide paid family medical leave. And the work itself becomes increasingly difficult as caseloads increase without additional staff hiring. A survey that was conducted here in my hometown of Austin by the Austin Travis County EMS Association, ably led by Selena Shee, found that almost 80% of our first responders working there were experiencing mental health challenges such as PTSD, anxiety, and sleep loss. These workers need mental health care, but they also need essential protections to improve their working conditions, like increased pay for the extraordinary demands of their job. I think that the mental health of so many Americans would be improved by the Senate action in passing, even at least debating, but passing the House-approved bills raising the minimum wage, protecting labor rights, establishing paid family and medical leave, and setting more adequate nurse staffing standards. And OSHA could immediately make their emergency workplace standard for health workers permanent. And of course, it's clear to, I think, almost everyone that those who have refused to mask, who have refused to immunize, have worsened our situation, and they have been worsened by those public officials who fail to condemn this and who don't act to encourage these public safety measures. Senate action on our House-approved legislation to close the coverage gap in states like Texas, where up to 2 million of our citizens have been denied access to health care because of the refusal of Republican state governors to expand Medicaid, would also greatly assist in providing additional mental health services. Another policy that I think is important, and the ranking member just mentioned it, is telemedicine. At one Lone Star Circle of Care Community Health Center here in Austin, 48% of telehealth visits in the past month were for behavioral health services. Just an example, a patient, an older patient caring for an adult disabled son is able to get telehealth visits for her own depression and caregiver fatigue that she might otherwise have to forego. The Telehealth Expansion Act, which I recently introduced with strong bipartisan support from leaders in this committee, is one thing that can be done to help us avoid a telehealth cliff when the public health emergency ends. Our legislation creates a pathway to keep telehealth services available with recommendations for guardrails, dealing with fraud, but basically assuring an inclusive design, affordability, and patient choice. I think moving forward with a markup on this bipartisan bill is one constructive step that our committee can take to improve mental health access. Ms. Avaluk, can you elaborate a little on the importance that you noted in your written testimony of patients having the certainty of access to mental health services and how telemedicine has improved access and continuity of care?
Yes, certainly. Thank you for the question. As I said earlier, I believe telehealth was really, truly what saved the behavioral health care delivery system. When we started early with the flexibility, behavioral health providers weren't sure how to do it. They are in a completely different place today. It has engaged people into treatment. It has decreased no-show rates. It has brought treatment to areas where physical barriers existed, so people couldn't get to care. It has really increased rates. What I will say is where plans have pulled back, there is evidence that people are disengaging. So if this flexibility is suddenly stopped, there will be a significant number of Americans that lose care.
Thank you so much, and thanks to all of our witnesses for their valuable testimony.